The local health department received information from the Centers for Disease Control and Prevention that the flu was expected to be very contagious this season. The nurses asked to set up flu vaccine clinics in local churches and senior citizen centers. This activity is an example of which level of prevention? The primary intervention B, tertiary intervention C, nursing intervention D, secondary intervention. Answer: a primary intervention rationale. Secondary intervention includes disease prevention after a health issue has been identified. Primary intervention is prevention of a health problem that has not yet occurred in the community. Tertiary intervention occurs after a problem has occurred and aims at preventing long-term negative impacts or recurrences in a population. What are the three elements included in a community assessment? A. Environment, families, and social systems. B. People, neighborhoods, and social systems. C. Structure or locale, people, and social systems. D. Healthcare systems, geographic boundaries, and people. Answer: C. Structure or locale, people, and social systems. Rationale. The community has three components: structure or locale, people, and social systems. To develop a complete community assessment, the nurse must take a careful look at each of the three components to begin to identify needs for health policy, health programs, and health services. Which of the following models of health or illness defines health as a positive, dynamic state, not merely the absence of disease? A. Maslow's hierarchy of needs. B. Rosenstock's health belief model. C. Pender's health promotion model. D. The holistic health model of nursing. Answer: C. Pender's health promotion model. Rationale. Pender's health promotion model was developed to be a complementary counterpart to models of health protection. This model defines health as a positive, dynamic state, not merely the absence of disease. Maslow's hierarchy of needs defines what is necessary for human survival and health, such as food, water, safety, and love. Rosenstock's health belief model addresses the relationship between a person's belief and behaviors. It predicts how clients will behave in relation to their health and how they will comply with their health regimen. The holistic health model creates conditions that promote optimal health. A 72-year-old man diagnosed with chronic obstructive pulmonary disease 5 years ago has been participating for the last 2 years in a pulmonary rehabilitation exercise class offered by the local hospital at a fitness facility. This is what level of prevention? A. Tertiary prevention. B. Primary prevention. C. Secondary prevention. D. Quaternary prevention. Answer: a tertiary prevention. Rationale. Tertiary prevention occurs when a defect or disability is permanent and irreversible, and the aim is to reduce negative impacts and complications. Primary prevention is true prevention that precedes disease and involves clients considered physically and emotionally healthy. Secondary prevention is aimed at individuals who are experiencing health problems or illnesses and who are at risk for developing complications or worsening conditions. Quaternary prevention is not a recognized term. Which activity would not be expected by the nurse to meet the cultural needs of the client? A. Developing the structure and process for meeting cultural needs on a regular basis and means to avoid overlooking these needs in clients. B. Expecting the client's family to keep an interpreter present at all times, day and night, to assist in meeting the communication needs of the client while hospitalized. C. Promoting and supporting attitudes behaviors, knowledge, and skills to respectfully meet the client's cultural needs despite the nurse's own beliefs and practices. D. Ensuring that the interpreter understands not only the client's language but also the feelings and attitudes behind cultural practices to make sure an ethical balance can be achieved. Answer. B. Expecting the client's family to keep an interpreter present at all times, day and night, to assist in meeting the communication needs of the client while hospitalized. Rationale. It is not the family's responsibility to assist in the communication process. Many families will leave someone to help at times, but it is the hospital's legal obligation to find an interpreter to provide continued understanding of the client and to ensure that the client is fully informed and comprehends in his or her primary language. The nurse should respect and recognize cultural needs in every client to be able to give holistic care to every client. The nurse should not use as interpreter a person who barely speaks the language, because many elements in language communication involve more than just saying the right words. Ongoing assessment and planning for incorporating cultural needs into the larger picture of healthcare will allow the client to feel fully cared for while in the hospital. A proposal written by a community-based nurse for a new, higher-quality older adult care center will have increased probability of acceptance if the proposal includes a. All building plans and a list of contractors to complete the job. B. Compliance with the codes and building requirements of local government agencies. C. The upfront cost and managerial framework of the new older adult center. D. Description of how advantageous, realistic, compatible, and adaptable the change will be when implemented. Answer. D. Description of how advantageous, realistic, compatible, and adaptable the change will be when implemented. Rationale. Change must be perceived as advantageous, compatible with existing values, and easily adaptable to be successful and accepted. Upfront cost, managerial framework, building plans, contractors, compliance with building codes, and regulations for governmental agencies are all incorporated in proposals but do not provide convincing reasoning that leads to change. A nurse is caring for a 64-year-old homeless woman with a chronic respiratory disease in the local community-based clinic. The nurse realizes that the client is at risk of experiencing exacerbation of the disease process related to a. Poor attire and cleanliness practices. B. The client's lack of education and ability to read. C. The individual's lack of concern about the disease. D. The client's lack of a storage site for medication and the inability to obtain nutritious meals. Answer. D. The client's lack of a storage site for medication and the inability to obtain nutritious meals. Rationale. The homeless person's lack of a storage site for medication and inability to obtain nutritious meals are factors that contribute to poor management of chronic disease. Homeless people are often stereotyped as having a lack of concern for their situations. Poor attire and lack of hygiene are not causes of chronic illness exacerbation. They are signs of the client's status as a member of an at-risk population. It is incorrect for the nurse to assume that the client lacks education and the ability to read. The nurse suggests that a client receive a palliative care consultation for symptom management because of anxiety and increasing pain. A family member asks the nurse if this means the client is dying and is now in hospice. The nurse explains which of the following: hospice, end-of-life care, and palliative care are the same thing. B. Palliative care is for any client, at any time, for any disease, in any setting. C. Palliative care strategies are primarily designed to treat the client's illness. D. Palliative care interventions relieve the symptoms of illness and treatment. Answer. B. Palliative care is for any client, at any time, for any disease, in any setting. Rationale. Palliative care is the prevention, relief, reduction, or soothing of symptoms of disease or disorders throughout the entire course of an illness. It is appropriate for clients of any age, in any setting, and for any disease. Hospice care focuses specifically on individuals with a limited life expectancy of less than 6 months, whereas palliative care does not need to focus on end-of-life issues. Palliative care focuses on symptoms, not the disease process. The nurse notes that a woman who recently began cancer treatment appears quiet and withdrawn, says she does not believe the treatments will make any difference, does not ask about her progress, and has missed 2 chemotherapy sessions. Based on these assessment data, the nurse would gather more information to consider making which of the following nursing diagnoses? A. Anxiety. B. Powerlessness. C. Spiritual distress. D. Anticipatory grieving. Answer. B. Powerlessness. Rationale. The area to consider with this client is powerlessness. She doesn't believe the treatments will help anyway. This client does not show signs of the other areas based on the information given. Presence involves a person-to-person encounter that A. Enables the client to care for the self. B. Provides personal care to the client. C. Conveys closeness and a sense of caring. D. Puts the nurse in close physical contact with a client. Answer. C. Conveys closeness and a sense of caring. Rationale. Presence involves being there and being with a client, including communication and understanding. It includes a sense of closeness and caring. The caring aspect of nursing may be negatively affected in clinical practice today primarily because of a. Lack of time constraints in nursing care. B. Increased emphasis on the nurse-client relationship. C. Prevalence of chronic conditions that slow the pace of nursing. D. Rise in technology that takes nurses' attention away from clients. Answer. D. Rise in technology that takes nurses' attention away from clients. Rationale. Increased technology tends to take the nurse away from the bedside. The prevalence of chronic conditions has a positive, not a negative, impact. The trend is toward greater acuity in clients' conditions. There are more time constraints because of disease acuity and technology. Clients' perceptions are important because healthcare organizations are A. Required always to act in the best interest of the client. B. Placing greater emphasis on client satisfaction. C. Under investigation for misappropriation of funds. D. Carefully watched and regulated by the federal government. Answer. B. Placing greater emphasis on client satisfaction. Rationale. A study of clients' perceptions is important because healthcare organizations are placing greater emphasis on client satisfaction. According to the Nurse Practice Act, NPA, how are cultural needs addressed? There are no references to culture or ethnicity of clients in the NPA. B. Knowledge of cultural aspects is to be incorporated into the plan of care to meet each client's unique needs. C. Cultural needs can be ignored when the client is very ill and about to die, because physical needs are more important at this time. D. Only scientifically based methods of treatment are to be used in nursing. Use of other methods or therapies is not the role of the nurse. Answer. B. Knowledge of cultural aspects is to be incorporated into the plan of care to meet each client's unique needs. Rationale. Assessment and implementation of care must consider the total needs of the client, and cultural needs are one of the major areas of assessment. In the standards of professional practice, the nurse is directed to follow all federal, state, and local laws governing the practice of registered nurses, and to provide nursing services without discrimination, regardless of the national origin, race, religion, or health problems of the client served. Cultural needs are incorporated, especially at the time of death, when many religious beliefs and practices of the client and family affect what care is expected from the healthcare team. A care activity does not have to have a scientific basis for it to be performed. If the client believes that a certain practice will help him or her get better and no harm is expected from the practice, the nurse is expected to support it for the betterment of the client. Transcultural nursing involves a. Working in another culture to practice nursing within the limitations of that culture. B. Ignoring all cultural differences to provide the best generalized care to all clients. C. Combining all cultural beliefs into a practice that takes a non-threatening approach to minimize cultural barriers and achieve equality of care for all clients. D. Using a comparative study of cultures to understand similarities and differences across human groups to provide specific individualized care that is culturally appropriate. Answer. D. Using a comparative study of cultures to understand similarities and differences across human groups to provide specific individualized care that is culturally appropriate. Rationale. Transcultural care means that the nurse understands and learns about specific cultural practices so that the nurse can integrate these practices into the plan of care for a client who adheres to these beliefs or practices in order to meet the client's needs in a holistic way. Transcultural nursing can be practiced anywhere. The nurse does not have to work within the given country under its practice limitations. Even if the nurse combines all cultural beliefs, the nurse still may not meet the belief needs of a specific client. The nurse cannot ignore needs and expect the plan of care to be satisfying or beneficial for an individual client. Taking a holistic approach to healthcare means meeting all of the physical, social, psychological, and spiritual needs of the client. Which factors are least significant during assessment when gathering information about cultural practices? A. Biocultural needs. B. Language. Timing. C. Touch and eye contact. D. Pain perception and pain management expectations. Answer. A. Biocultural needs. Rationale. Cultural practices do not influence biocultural needs. Because biocultural needs are inborn risks that are related to a biological characteristic and not a learned cultural belief or practice. Language and timing do have an impact on how practices are shared with the healthcare provider. Touch and eye contact can be interpreted differently in other cultures. Pain is interpreted as having a variety of causes depending on culture. Pain can be perceived as punishment from God, a consequence of a past life, or something to be endured with or without the aid of certain behaviors. A number of strategies have the potential for creating work environments that enable nurses to demonstrate more caring behaviors. Some of these include the increasing working hours, B, raising monetary compensation, C, providing flexibility, autonomy, and improved staffing, D, increasing input from physicians concerning nursing functions. Answer: C. Providing flexibility, autonomy, and improved staffing. Rationale: strategies to create work environments that allow nurses to demonstrate more caring behaviors include introducing greater flexibility in the work and environment structure, rewarding more experienced nurses in non-monetary ways, improving nurse staffing, and providing nurses with autonomy over their practices. A client is fearful of upcoming surgery and a possible cancer diagnosis. The client has discussed a love of the Bible with the nurse, who then recommends a favorite Bible verse. The nurse is reprimanded and told that there is no place in nursing for spiritual caring. Which of the following would be an appropriate response? A. It is true that spiritual care should be left to a professional. B. You are correct. Religion is a personal decision. C. Spiritual, mind, and body connections can affect health. D. I will be more careful not to share my religious beliefs with clients. Answer: C. Spiritual, mind, and body connections can affect health. Rationale: research shows a link between spirit, mind, and body, and an individual's beliefs and expectations do have effects on the person's well-being. Nurses should not force their beliefs on clients, but sharing is a part of caring. The nurse demonstrates the concept of knowing the client when he or she A. Gathers pertinent data about the client's condition. B. Predicts the need for certain interventions based on the disease process. C. Encourages the client to depend on the nurse to make important decisions. D. Is able to detect changes in the client's condition based on shared information and bonding. Answer: D. Is able to detect changes in the client's condition based on shared information and bonding. Rationale: the nurse who knows the client can predict responses, capacity, and endurance because the two have a mutual sense of bonding. Truly knowing the client is much more than gathering data. A relationship is necessary. The nurse must avoid assumptions based on knowledge of the disease process and rely on information revealed by the client. The client should make decisions, and the nurse should work with the client to help so that it is a mutual process. When providing health maintenance teaching to new employees in the food handling department, the nurse emphasizes the need to perform hand hygiene after using the bathroom to prevent A. Food poisoning. B. Spread of hepatitis A. C. Bacterial food infections. D. Salmonella contamination. Answer: B. Spread of hepatitis A. Rationale: the hepatitis A virus is spread via fecal contamination of food, water, or milk. It is essential that food handlers wash their hands anytime they use the bathroom. Food poisoning can be due to bacterial contamination of food from a variety of sources, but not usually feces. Salmonella contamination usually arises from uncooked eggs. During the nurse's assessment of a 56-year-old man, he reports increased alcohol consumption because of stress at work. One of the expected outcomes for this client will be to A. Decrease stress in his life. B. Teach him ways to promote sleep. C. Decrease his alcohol intake during times of stress. D. Provide the client with information about stress management classes. Answer. D. Provide the client with information about stress management classes. Rationale. Resources for stress management and sleep promotion can help accomplish reduced alcohol intake during times of stress in the client's life. Management of stress is the expectation, but decreasing stress may not be possible. The family of the nurse is confused. Ambulatory client insists that all 4 side rails be up when the client is alone. The best way to handle this situation is to A. Ask them to stay with the client at all times. B. Inform them of the risks associated with side rail use. C. Thank them for being conscientious and put the 4 rails up. D. Provide the client with a 1-to-1 sitter while the side rails are up. Answer. B. Inform them of the risks associated with side rail use. Rationale. The use of side rails when a client is disoriented will cause more confusion and further injury. A confused client who is determined to get out of bed may attempt to climb over the side rail or climb out at the foot of the bed, and may fall or experience other injury. After the nurse has this discussion with the family, then the nurse should perform a thorough nursing assessment and develop a plan to ensure the client's safety. During the night shift, a client is found wandering the hospital halls looking for a bathroom. The nurse's initial intervention would be to A. Insert a urinary catheter. B. Ask the physician to order a restraint. C. Assign a staff member to stay with the client. D. Provide scheduled toileting during the night shift. Answer. D. Provide scheduled toileting during the night shift. Rationale. Providing scheduled toileting during the night makes it less likely that a client will wander while being confused and ensures staff presence to decrease confusion at the times when the client is away from bed. Inserting a urinary catheter is not necessary. Assigning a staff member to stay with the client might not be necessary if the scheduled toileting is successful. Restraints are unnecessary in this case. The nurse discovers an electrical fire in a client's room. The nurse's first action would be to A. Activate the fire alarm. B. Confine the fire by closing all doors and windows. C. Evacuate any clients or visitors in immediate danger. D. Extinguish the fire by using the nearest fire extinguisher. Answer. C. Evacuate any clients or visitors in immediate danger. Rationale. The nurse's first step when a fire is discovered is to evacuate any clients or visitors in immediate danger. Then the nurse should activate the fire alarm, confine the fire, and then extinguish it. A nurse should assess the client's and family's wishes for end-of-life care. It is important for the nurse to remember to A. Keep what is learned about a client's preferences to him or herself. B. Avoid self-reflection because it may interfere with caring for dying clients. C. Have family members follow hospital routines rather than engage in their specific cultural or spiritual practices in end-of-life care. D. Find a healthcare provider who is experienced in discussing end-of-life issues if the nurse feels uncomfortable doing so. Answer. D. Find a healthcare provider who is experienced in discussing end-of-life issues if the nurse feels uncomfortable doing so. Rationale. A nurse must assess the client's and family's wishes for end-of-life care, including the preferred place for death, the level of life-sustaining measures to employ, and expectations regarding pain and symptom management. If the nurse feels uncomfortable in assessing a client's wishes, Then the nurse must find a healthcare provider who is experienced in discussing end-of-life issues and can assist in communicating a client's preferences to the total healthcare team. A nurse cannot keep what is learned about a client's preferences private. Good interdisciplinary teamwork is essential to provide quality end-of-life care. Self-reflection is a valuable tool in maintaining professionalism and knowing when to get away from a situation and take care of oneself. Facilitating connections to preferred spiritual practices and supporting the expression of culturally held beliefs is very important and can provide comfort to the client and family. A client for whom there is a "do not resuscitate" order passes away. After verifying that there is no pulse or respirations, the nurse should next A. Call the transplant team to retrieve vital organs. B. Call the funeral director to come and get the body. C. Have family members say goodbye to the deceased. D. Remove all tubes and equipment. Unless organ donation is to take place, clean the body, and position the body appropriately. Answer. D. Remove all tubes and equipment. Unless organ donation is to take place, clean the body, and position the body appropriately. Rationale. The body of the deceased should be prepared before the family comes into view and say their goodbyes. This includes removing all equipment, tubes, supplies, and dirty linens according to protocol. Bathing the client. Applying clean sheets, and removing trash from the room. The body should be cleaned and positioned before the family is given the option to view or not to view the body. Organ transplant and donation would first have to be discussed with the family. The funeral home is not called until after family members have had the opportunity to say their goodbyes. Bereavement may be defined as A. The emotional response to loss. B. The outward, social expression of loss. C. Postponement of the awareness of the reality of the loss. D. The inner feelings and outward reactions of the survivor. Answer. D. The inner feelings and outward reactions of the survivor. Rationale. Bereavement includes grief and mourning. Option 1 is the definition of grief. Option 2 is the definition of mourning. Postponement of the awareness of the reality of loss describes what may occur during the bargaining stage of dying according to Kubler-Ross. What are the stages of dying defined by Elizabeth Kubler-Ross? Denial, anger, bargaining, depression, and acceptance. B. Anticipatory grief, perceived loss, actual loss, and renewal. C. Numbing. Yearning and searching, disorganization and despair, and reorganization. D. Accepting the reality of loss, working through the pain of grief, adjusting to the environment without the deceased, and emotionally relocating the deceased and moving on with life. Answer. A. Denial, anger, bargaining, depression, and acceptance. Rationale. Denial, anger, bargaining, depression, and acceptance are the 5 behavior-oriented stages of dying according to Elizabeth Kubler-Ross. When the nurse is caring for a terminally ill client, it is important for the nurse to maintain the client's dignity. This can be facilitated by a. Spending time to let the client share his or her life experiences. B. Making decisions for the client so the client does not have to make them. C. Placing the client in a private room to provide privacy at all times. D. Decreasing emphasis on attending to the client's appearance because such personal care only increases the client's fatigue. Answer. A. Spending time to let the client share his or her life experiences. Rationale. Spending time to let the client share his or her life experiences enables the nurse to know the client better. Knowing the client then facilitates choosing therapies that promote client decision-making and autonomy, and thus promote the client's self-esteem and dignity. Basic to promoting a client's self-esteem and dignity is attending to the client's appearance and surroundings. Cleanliness, absence of body odors, wearing of attractive clothing, and personal grooming all contribute to a sense of worth. Helping the client make his or her own decisions helps maintain autonomy. Being autonomous plays a vital role in maintaining the client's dignity. The client should not be placed in a private room unless family members visit and plan to stay around the clock. A client in the end stage of terminal cancer is hospitalized. His family members are sitting at his bedside. What can the nurse do to best aid the family at this time? A. Find simple and appropriate care activities for the family to perform. B. Limit the time visitors may stay so they do not become overwhelmed by the situation. C. Avoid telling family members about the client's actual condition so they will not lose hope. D. Discourage spiritual practices because this will have little meaning for the client at this time. Answer. A. Find simple and appropriate care activities for the family to perform. Rationale. It is helpful for the nurse to find simple care activities for the family to perform, such as feeding the client, washing the client's face, combing the hair, and filling out the client's menu card. This helps the family demonstrate their caring for the client and enables the client to feel their closeness and concern. Older adults often become particularly lonely at night and may feel more secure if a family member stays at the bedside during the night. The nurse should allow visitors to remain with dying clients at any time if the client wants them there. It is up to the family members to determine if they are feeling overwhelmed, not the nurse. The nurse should keep the family informed so the family can anticipate the type of symptoms the client will likely experience and the implications for care. Facilitating connections to a spiritual practice or community and supporting the expression of culturally held beliefs can provide comfort for many clients, especially at this time. It is one day after the client underwent a mastectomy for the treatment of her breast cancer. The client is crying when the nurse enters the room. Which of the following is the nurse's best response? A. Let me get you something for pain. B. You seem upset. Would you like to tell me about what is bothering you? C. Cheer up. The worst is behind you now, and you'll start feeling better soon. D. You shouldn't be crying now. Just wait until you go home and you're all alone without us to help you. Answer. B. You seem upset. Would you like to tell me about what is bothering you? Rationale. The nurse should use therapeutic communication skills to clarify the feelings of the client. The nurse should use open-ended questions, attentive listening, and presence to allow the clients to freely share her thoughts and concerns. Answer. C. The stages of grief may occur in the standard order, they may be skipped, or they may reoccur. Rationale. Grief is manifested in a variety of ways that are unique to the individual and based on personal experiences, cultural expectations, and spiritual beliefs. The coping mechanisms that were effective in the past are repeated as a first response to the pain of a loss. When older coping strategies are unsuccessful, new coping mechanisms are attempted. The type of loss and the perception of the loss influence the depth and duration of grief a person experiences. The nurse must not assume that clients want to be left alone. If a client chooses not to share feelings or concerns, the nurse should convey a willingness to be available when needed. Sometimes clients need to begin resolving their grief before they can discuss their loss. A client has recently been told he has terminal cancer. As the nurse enters the room, he yells, "My eggs are cold. And I'm tired of having my sleep interrupted by noisy nurses." The nurse may interpret the client's behavior as A. The result of previous losses. B. The result of maturational loss. C. An expression of disenfranchised grief. D. An expression of the anger stage of dying. Answer: D. An expression of the anger stage of dying. Rationale: in the anger stage of Kubler-Ross's stages of dying, the individual resists the loss and may strike out at everyone and everything, in this case, the nurse. Disenfranchised grief occurs when a person experiences a loss that cannot be openly acknowledged, is not socially sanctioned, or cannot be publicly shared. A maturational loss is any life change that occurs in the developmental process and is normally expected during a lifetime. Previous losses may compound the feeling of loss and influence the individual's reaction when an additional loss occurs, but this question did not mention previous losses by the client. During post-mortem care, the nurse should give priority to A. Locating the client's clothing. B. Providing culturally and religiously sensitive care in body preparation. C. Transporting the body to the morgue as soon as possible to prevent body decomposition. D. Providing all post-mortem care to protecting the deceased's family from having to see the body. Answer: B. Providing culturally and religiously sensitive care in body preparation. Rationale: providing the integrity of rituals and mourning practice gives families a sense of fulfilled obligations and promotes acceptance of death. If the family wants to provide post-mortem care, then the nurse should be sensitive to their needs. The body should be transported to the morgue when the family is ready. Locating the client's clothing is not a priority. It can be done after the other tasks are completed. A self-care goal for the nurse who cares for dying and grieving clients might be to A. Learn not to take the loss so seriously. B. Limit involvement with clients who are grieving. C. Maintain life balance and reflect on the meaning of one's work. D. Admit that one is not well suited to care for grieving clients and families. Answer: C. Maintain life balance and reflect on the meaning of one's work. Rationale: for nurses who work with dying and grieving clients, the maintenance of life balance and reflection on the purpose for the work is the key to longevity in the career. Loss is serious, and nurses do take loss seriously. Involvement with grieving clients can be healthy for the nurse. Nurses need to determine what discipline in nursing works for them. The nurse demonstrates caring behavior when he or she A. Leaves the light off in the client's room. B. Pats the client's arm when approaching the bed. C. Asks the client if he or she needs anything while exiting the room. D. Traces the intravenous IV tubing from the arm to the fluid bag while checking for kinks. Answer: B. Pats the client's arm when approaching the bed. Rationale: physical contact as a means of expressing caring. Leaving the lights off interferes with eye contact and clear communication. Caring for the IV shows attention to technology and details rather than to the client. Although asking if the client needs anything is kind. If the nurse does not wait for an answer and is not offering presents, this is not a caring behavior. A family member of a recently deceased client talks casually with the nurse at the time of the client's death and expresses relief that she will not have to visit at the hospital anymore. Which of the following may apply to this family member in terms of her grief? A. Denial. B. Anticipatory grief. C. Dysfunctional grief. D. Yearning and searching. Answer. A. Denial. Rationale. In the denial stage, a person acts as though nothing has happened and refuses to accept the fact of a loss. This is a normal stage and is a self-protective mechanism. In dysfunctional grief, the grieving person has a prolonged or significantly difficult time moving forward after a loss. Emotional outbursts of tearful sobbing and acute distress characterize Bowlby's second stage of grief, termed yearning and searching. A person experiences anticipatory grief, the unconscious process of disengaging or letting go, before the actual loss or death occurs, especially in situations of prolonged or predicted loss. According to Watson's transpersonal caring theory, the nurse should understand which of the following. A. The act of caring is personal and cannot be shared. B. Caring can increase healing and promote well-being. C. Expressions of human caring are the same for all individuals. D. Nurses must use caring behaviors specific to their own cultures. Answer. B. Caring can increase healing and promote well-being. Rationale. Conscious caring by the nurse can promote healing and is complementary to conventional nursing practice. Caring can be shared and is a powerful connection between individuals. It is important for the nurse to appreciate the culture of the client and incorporate this into the care. Caring is individual and is different for all. Because clients and nurses may differ in their perceptions of caring, it is important that the nurse A. Focus on keeping the relationship on a business level. B. Follow his or her own beliefs about what is appropriate. C. Seek information regarding what is important to the client. D. Allow a more experienced nurse to establish the nurse-client relationship. Answer. C. Seek information regarding what is important to the client. Rationale. It is important to assess the client's needs and expectations of care. Clients relate to nurses on a personal level. The client's beliefs must be considered. Personnel at all levels of nursing should have effective relationships with clients. Which of the following nurses is showing behavior that indicates that the nurse is providing presence in a caring relationship? A. The clinic nurse who pats the client on the back for reassurance. B. The newly licensed nurse who braces the client as he or she gets out of bed. C. The home care nurse who focuses attention on the older adult client sharing a story. D. The staff nurse who stays with a client who is undergoing an unfamiliar procedure. Answer. D. The staff nurse who stays with a client who is undergoing an unfamiliar procedure. Rationale. Coaching a client through an experience is an example of presence. As is sitting by a client's bedside. The nurse is providing safety while helping the client get out of bed. In option 3, the nurse is listening. The nurse demonstrates listening skills by A. Blocking nonverbal communication so that the verbal communication is more defined. B. Waiting until mealtimes so that the conversation can be more sociable. C. Surrounding the client with family and friends to make him or her comfortable. D. paying attention to the tone of voice in addition to the client's words so the meaning is clear. Answer. D. Paying attention to the tone of voice in addition to the client's words so the meaning is clear. Rationale. The client's tone of voice supplies cues that allow the nurse to better understand the client's frame of reference. Nonverbal cues add meaning to the verbal communication and increase understanding. Surrounding the client with family and friends serves as a distraction to communication between client and nurse. A client's hunger, pain, or other distractions can hinder communication. A client's family member remarks to the nurse, "The doctor said he will provide palliative care." What does that mean? Which of the following is the nurse's best response? A. Palliative care aims to relieve or reduce the symptoms of a disease. B. Palliative care is given to those who have less than 6 months to live. C. The goal of palliative care is to cure a serious illness or disease. D. Palliative care means that the client and family take a more passive role and the doctor focuses on the physiological needs of the client. Death will most likely occur in the hospital. Answer. A palliative care aims to relieve or reduce the symptoms of a disease. Rationale. The goal of palliative care is the prevention, relief, reduction, or soothing of symptoms of disease or disorders without effecting a cure. Palliative care is for clients of any age, with any diagnosis, and at any time, and not just during the last few months of life. Generally, clients accepted into a hospice program have less than 6 months to live. Palliative care aims to relieve pain and other distressing symptoms, not cure the disease. Palliative care is a philosophy of total care. Care options encompass the physical, psychological, social, spiritual, and existential aspects of the client's illness. Care is provided by an interdisciplinary team, and the client and family take an active role in decision-making. The location of death may or may not be the hospital. A home health nurse is asked by a family member what he should do if the client's serious chronic illness continues to worsen even with increased medical interventions. The nurse recognizes that the family member is posing a question about goals of care at the end of life. The nurse should A. Encourage the family to think more positively about the client's new therapy. B. Avoid the discussion because it has to do with medical, not nursing, diagnoses. C. Begin the discussion by asking the family member what he believes the goals should be. D. Initiate a discussion about advance directives with the client, family, and healthcare team. Answer. C. Begin the discussion by asking the family member what he believes the goals should be. Rationale. The nurse must first assess the family's goals before any further discussions can take place. Then, with the appropriate knowledge, the nurse can continue discussions regarding options for future care, either disease treatment or end-of-life care, based on the family's needs and wishes. Regarding a request for organ and tissue donation at the time of death, the nurse should be aware that specially educated personnel make these requests. B. These requests are usually made by the nurse caring for the client at the time of death. C. Professionals should be very selective in whom they ask for organ and tissue donation. D. Only clients who have given prior instruction regarding donation can become donors. Answer. A. Specially educated personnel make these requests. Rationale. A specially trained professional makes requests for organ and tissue donation at the time of death. The person requesting organ or tissue donation provides information about who can legally give consent, which organs or tissues can be donated, associated costs, and how donations will affect burial or cremation. If the deceased did not leave behind instructions for organ and tissue donation, the family may give consent at the time of death. Family members make the following comments about the nursing care being received. Which one should be investigated further? A. The nurses showed us how to keep mother's arm propped on a pillow. B. Our nurses don't seem too optimistic about the outcome of dad's stroke. C. The night nurse tells us to wait and ask the doctor the questions we have. D. The nurses have written down the turn schedule and taped it above the bed. Answer. C. The night nurse tells us to wait and ask the doctor the questions we have. Rationale. A caring nurse should show interest in answering questions and giving clear explanations. The comment in option 3 indicates that the nurse is shirking responsibility. Teaching the family is important and gives the family the feeling of being useful. Keeping the family informed and included in care is a sign of good nursing. Honesty is a quality of caring. False reassurance is dishonest and is not helpful. In caring for a client, the nurse would describe learning about the client's family as A. Essential. B. Unnecessary. C. A waste of time. D. Okay to do when one has the time. Answer. A. Essential. Rationale. Each individual experiences life through their relationships with others, so learning about the client's family is essential in learning about the client.